Informed consent prior to immunization. Consent for series process. Standard information for chickenpox, varicella vaccine. Example 12 months. May 2013. This video will show the vaccine provider discussing the standard information for varicella vaccine. The vaccine provider will use a HealthLink BC file and format.
So the next immunization that we're going to talk about today at the 12-month visit is the chickenpox or varicella vaccine. So just like we've said with the other vaccines, you're keeping your child safe by getting all the shots on time and in the recommended schedule. We give this vaccine to actually protect children against getting sick with chickenpox. And immunization has saved more lives in Canada in the last 50 years than any other health intervention that we've done. So the chickenpox vaccine we offer at 12 months of age and then a second dose at 4 to 6 years of age or going into kindergarten. With the chickenpox vaccine, sometimes people will think, oh, if I've had chickenpox, I wouldn't need that. If your child has had chickenpox at less than a year, they may not develop that lifelong immunity that they need to have protection and could develop chickenpox and get sick later on. So we'd still recommend 2 doses of the vaccine. However, if your child did have chickenpox over a year, then they wouldn't need to have the vaccination. I'm going to give you a record today of the varicella vaccine, and that's important for you to keep. So this vaccine is the best way to protect against chickenpox and the complications that may happen. Just so that you know, in 3 out of 20 children, they can develop chickenpox after having the vaccine. But what's different is they're often much milder cases and don't have more of those severe complications. So when we give the vaccine, you're not only keeping your child well, but also other children, because if your child can't get sick with chickenpox, then they can't spread it to anybody else. This vaccine is very safe. It is much safer than actually letting your child have chickenpox. The common reactions are similar to what we've discussed with other immunizations: soreness, redness, and swelling at the injection site in the back of the arm. Sometimes there can be a mild fever or a rash, which looks like chickenpox but with fewer spots, and that occurs usually around 2 weeks after the vaccine. That may not happen, but it could happen, and I just want you to know what to look for. It is rare, but sometimes a person can get a rash after the immunization and actually spread it to other people. We want to prevent that from happening. So if your child did develop any of those spots, or they're like a blister and they kind of have fluid at the top, you'd want to keep those covered until the blisters have dried and crusted over, and then they're no longer contagious. If your child did have fever or did have pain, you can definitely give acetaminophen, which is Tylenol, based on her weight. I know we've discussed this already, but I do want you to wait in the clinic for 15 minutes today after the immunization. Even though it's so rare, it's fewer than 1 out of a million, we want to be sure that there's no signs of anaphylaxis, which is a life-threatening allergic reaction, which would be swelling of the throat, tongue, or lips, problems breathing, hives, redness and swelling in the body. So if that happened, I would give epinephrine, which is adrenaline, right away to stop the reaction, and then we would call 911. So if you got home today and you started to see those symptoms I've just described to you, I'd want you to call 911, all right? Just a reminder, I always want you to report back serious or unexpected events to me. So if something happens that you're not sure, is this related to the immunization, or if you had to go to the doctor, to the hospital, you always call back and report to public health. So I wouldn't give the vaccine to your daughter today if you said she's had the vaccine before and had an allergic reaction to it, if her immune system was weakened by disease or a medical treatment, if there had been a blood transfusion or blood products in the last year. And we've talked about health already, and you haven't said that there's any concerns, so we can go ahead and immunize. And just to let you know, you probably know what chickenpox is, but often for children, there's an average of over 350 red itchy blisters all over the body. And for those that are older, like teenagers or adults, or those with weakened immune systems, it can be even more severe. Complications from chickenpox. A lot of us think, oh, why do I need chickenpox? It's just normal. I had it. Why can't my child? It's because of the complications like pneumonia, which is a lung infection, encephalitis, also bacterial infections of the skin. So those different spots that can happen can get infected. We really want to prevent things like that from happening. And even in adults, in 1 out of 3,000, they can actually pass away from the infection. So prevention, as they say, is the best medicine. This virus is really easily spread in the air, so I'm sick with chickenpox, I'm coughing, I'm sneezing, and then it can be spread. Also, those blisters that we talked about, and that's why we keep it covered until it crusts over. So that's just all the information I wanted to share with you about varicella, and we just got a couple more vaccines to talk about, and then we can go ahead and immunize.
The vaccine provider will ensure the parent understands the information described in the health file. After this has been completed, the vaccine provider will continue with the steps in the informed consent process. That is, to allow the parent to have their questions answered, and for the vaccine provider to confirm the parent consents for their child's immunization.